Hey, what's going on everybody? Remy Sovereign here from RemySovereign.com. Today what I wanted to talk about and address, and this is something that I've been asked quite a few times, is regarding the McKenzie exercise or kind of McKenzie Stretch kind of program for treating a bulging or herniated disc. And with regards to the McKenzie Stretch, it's a stretch that involves an individual going into a prone position where you're on your stomach and then you're extending into an extension-based position with regards to your lower back, or a hyperextension position. And kind of the theory behind it is that it's going to move the disc anteriorly. So if you have a bulging disc posteriorly, you're going to move the disc anteriorly because you're going into that extension-based position. Now, the problem with this is it's flawed thinking, and I'll tell you why. And it's something, I followed and I believed in the early stages of my recovery when I tried performing the McKenzie Stretch and when it was recommended to me. And the reason why it's flawed is because a bulging or herniated disc does not heal that way. It does not, in a sense, go back into position like that, where it's more so the physiological factors that are at play. So for example, if you have maybe a disc extrusion or a sequestered disc or whatever, herniated disc, the material that is from the nucleus that is kind of bulged out essentially will kind of be reabsorbed back into the disc, and this may occur via neovascularization, where we're laying down new blood vessels, we're getting more nutrients into the disc, and we're kind of maybe removing any debris or any kind of additional material that has kind of accumulated, and removing any of that negative or bad material from the disc. And so what I'm trying to state here is it's the physiological factors that are at play that are specifically influencing the recovery, or the biological factors. And that's specifically influenced by our diet, nutrition, our sleep, and even exercise to an extent as well. But with regards to the McKenzie Stretch, just moving into that extension position, if you consistently do that over time, it's not essentially healing the disc. And there are problems with this stretch. And the reason I'll talk about some of the problems is that, number one, is it's never really a good idea to go into a hyperextension position with regards to the low back and hold that position for a period of time. The reason being is because it could place a lot of stress onto the facet joints, and over time that may cause problems or irritation, especially if someone may have some already underlying lingering issues with regards to maybe some sort of extension-based back pain issues. But at the same time now, if you're wondering why maybe someone with a herniated disc gets pain from doing a McKenzie Stretch, and I could personally kind of relate to this because when I was kind of prescribed to do the McKenzie Stretch or McKenzie exercise, going into that hyperextension position caused me pain with regards to my lower back. And the reason being is because if we look at the biomechanics of the spine, and if you kind of just look to my spine, so if you're going to extension, what ends up happening is you're decreasing the space between the posterior sides of the vertebrae. So when you have the vertebrae and then you got your disc in between, so you're decreasing that space on the posterior side. So when you're decreasing the space on the posterior side, that already bulging material is going to kind of be pressurized, and it's going to be pinching that kind of bulging material per se, and it may push it out just slightly further. And that would not be a good thing, because now what's going to happen is that could maybe cause some sort of irritation to a nerve root if it's kind of pushed far enough, or cause some sort of an inflammatory response to accumulate. And that's why one may experience pain if they have a herniated disc posteriorly and they perform a McKenzie Stretch or McKenzie exercise, and they kind of get a pain or flare up with regards to that. And so that's the reason why, is because of the way the biomechanics are with regards to already having that bulging or herniated disc outside of its normal position. And then when you kind of go into that extension position, decreasing that space on the posterior side, that already bulging material will kind of move out slightly further. And that's what in theory would kind of cause that pain trigger. And so that's why I'm not personally a big fan of the McKenzie Stretch or McKenzie exercise. And it's commonly prescribed, commonly see it all the time, advised for people to perform with regards to a herniated or bulging disc. And if you even just go online on YouTube and maybe type in McKenzie Stretch or best exercises for sciatica, I guarantee you will see this stretch commonly come up in the search results from 1, 2, 3, 4, 5, all the way kind of down. A lot of physical therapists, maybe even chiropractors, doctors recommend this. And the reason they recommend it is because it decreases intradiscal pressure, but you could just decrease intradiscal pressure by laying on the ground, laying on your stomach, putting 2 pillows underneath kind of your hips, just kind of resting there. And that's kind of the position that I found most beneficial to me. And it wasn't so much just continuously going into the hyperextension position. I personally believe it's flawed thinking. And while it sounds good in theory, and I did believe this kind of in the early stages of how kind of a bulge or herniated disc heals, is because you have to move it anteriorly. That's not how it heals and drives the physiological processes at play that takes time and directly is and is directly influenced by nutrition, sleep, exercise, and a whole bunch of other factors as well. So that's my take on the McKenzie stretch and the McKenzie exercise, guys. And I just wanted to kind of make this video. I'm personally not a fan of it, but there may be some people out there that have actually had maybe experienced benefits from it. Who knows? That's just my opinion. If you're someone that maybe has experienced problems with it, or if you found that it made your kind of pain worse, I would love to hear your story. But also maybe if it's helped you, I'd also love to hear your story as well and how that kind of affected you. So guys, that's it for this video. Hope you guys enjoyed this. Hope this kind of clarifies things. And you know, I wish I could have kind of explained this from a more visual perspective, because I know it can be a little bit confusing with what I'm kind of maybe talking about without kind of displaying kind of a visual perspective how the mechanics of the spine would work with regards to a bulging disc. And while I would, in a perfect world, I'd like to kind of get some of the some educational material with regards to the spine and kind of with regards to showing an actual disc bulging out. The kind of educational materials are pretty expensive, and for just doing one video, it's kind of, I don't really have the resources to do that at the moment, but maybe in the future, I'll do that and kind of explain it better. But if you're someone that maybe has any questions regarding this or understanding that, leave a comment below. I could explain that to you maybe one-on-one personally. But with regards to that, just wanted to wrap up the video, guys. Hope you guys enjoyed this. Hopefully this clarified things, and I wish you guys all the best and a successful and productive day. And also, if you guys want, feel free to follow me on Instagram and Snapchat. If you're looking to kind of maybe get a little bit, if you want to get a little more interactive and get a little bit more content, because I post some things there with regards to my journey, and I'm also a little bit more interactive with some of my subscribers or followers there as well. So guys, that's it. Take care, and I'll see you next time.